Hello, this is Peptide Proof. Let's get right into it. So, in early 2026, Britain's MHRA, that's the Medicines and Healthcare Products Regulatory Agency, launched a pretty massive investigation into peptide clinics across the UK. Basically, they're zeroing in on clinics making unlawful health claims about unlicensed treatments, and they're really cracking down on what's essentially become a highly scrutinized regulatory gray zone.
The MHRA is going straight after clinics that are offering injectable peptides without proper marketing authorization. And the specific compounds in their crosshairs, we're talking about BPC 157, TB 500, and various GLP-1 analogs. These are names you've probably seen heavily promoted on your own social feeds. But here's the catch. Under UK law, advertising these for off-label cosmetic or wellness purposes like anti-aging, weight loss, or performance enhancement is completely unlawful. And the risks these businesses are taking right now are massive. The potential penalties actually include criminal prosecution, huge fines, and even complete closure orders.
Now, the core conflict driving this crackdown really just comes down to two opposing forces colliding. On one side, you have the surging consumer demand. It's fueled by a perfect storm of viral social media trends, celebrity endorsements, and of course, the absolute explosion of GLP-1 weight loss drugs. But on the other side, you've got a severely lagging regulatory framework. Because regulations simply haven't kept pace with all this hype, a lot of the peptides being sold in clinics today exist in a really dangerous gray zone. They're caught somewhere between a supplement, a cosmetic, and a highly regulated medicine.
But it's actually really important to understand that this isn't just an isolated UK issue. Regulators globally are struggling to distinguish between legitimate therapeutics, the ones actually backed by rigorous clinical trials and proper manufacturing, and opportunistic products making some wildly exaggerated claims. The MHRA's crackdown definitely mirrors a much broader international pattern. It directly parallels the US FDA's recent increased scrutiny and their own tightening of rules around peptide compounding pharmacies.
At the end of the day, the scientific reality is pretty straightforward. Peptides are biologically active molecules. When they're injected or taken as a medicine, they fall under strict drug regulations for a very good reason, to ensure safety, efficacy, and uncompromising quality control. As consumers, we really need to keep in mind that clinics making dramatic, life-changing claims about unlicensed peptide treatments should be viewed with the exact same skepticism as literally any other unregulated medical product.
So, where does that leave us? Well, the MHRA investigation that kicked off in early 2026 represents an active, ongoing enforcement right now in the market. Looking ahead, industry observers expect official guidance updates within the next 6 to 12 months. That should finally clarify which peptide products actually fall under medicinal regulations versus cosmetic frameworks. The regulator's message is crystal clear. Explosive market growth attracts serious attention, and that attention comes with strict enforcement. But it does leave us with one massive question. As regulators finally catch up to the science, will the peptide clinic industry adapt and legitimize, or is it going to be completely regulated out of existence? Thank you for joining Peptide Proof.